This is part one of a three-part series on control cases that Rick suggested that we do. So the first thing we're going to do is we're going to look at teeth where there was no instrumentation and only water irrigation used. Then no instrumentation with water and sodium hypochlorite. And lastly, sodium hypochlorite and EDTA. So the first case control study is just no instrumentation and only water irrigation. We're going to look at the coronal, middle root, and apical third of the root separately. This is how the cases were controlled, how the control cases were done. It's not ideal, but this is just to get some familiarity with the pattern recognition. So we took a tooth, we sectioned it sagittally, cut it with a razor blade into two halves, and then we just basically pulled the pulp out as best we could, and then we irrigated only with water using a Stropco and a nylon brush. We've seen before that the nylon brush does not affect the root dentin very much, so you get kind of a virgin look at what the dentinal wall looks like with no instrumentation and no irrigation other than water. So this is the coronal, a part of the root, and you see a canal wall relatively devoid of any pulpal tissue at all, and you're actually looking at the naked dentinal wall there. And if you look carefully as you zoom in, you can see there doesn't appear to be any kind of a smear layer, and there are open dentinal tubules in the coronal part of the root with some debris on the surface, but nothing outstanding. It looks like a very clean dentinal wall. You can kind of make out the difference between the peritubular dentin and the intertubular dentin. But basically the dentinal wall looks intact. And as you look closely, you see these strange bodies that look like spheres, and these are part of the calcospheroids from the predentin that was not removed with the water wash. In the dehydration procedure, much of the predentin is removed, but here you can see in the other half, you can see kind of a film covering, and what that is the non-calcified or partially calcified predentin that is still present sitting on top of the mineralized dentin. So it's good to develop some pattern recognition for what this looks like, because you're going to see it in instrumented cases. And when you go in and you look at this, you can see it gives kind of an impression of a smear layer type of presentation, but when you look closely, you can actually see the partially calcified calcospheroids of the predentin. And as you look at that, you can see these calcospheroids. Some actually looks like they've gone down into the tubules, and you can kind of get a sense of the structure of the predentin, the collagenous structure where here it is partially calcified and partially not mineralized. So this gives you some good pattern recognition when you see this, because we'll see this in instrumented cases that have been irrigated with our typical solutions. You can see the collagen network of the dentin there as well, and fairly well mineralized. And there's the substructure of the predentin. In the midroot area, the dentin changes its appearance considerably from the coronal. And when you actually go into it, again, you don't really see any kind of a smear layer, but you do see the collagenous nature of the dentin and how the architecture changes from the coronal aspect. And you can see that that looks completely mineralized. When you look carefully, you can see some unmineralized part and the collagenous nature of it. Here you can see the fibrillar nature of the collagen and the partial mineralization of it. So this is good to put in your memory banks because this could be easily confused for a biofilm. And now looking at the apical segment, you can actually see some pulp stones there in the apical segment of the root. And here again, the character of the dentin is different. You can see maybe a little more remnants of pulp tissue there. And here you can see some partial mineralization of the dentin. And you can see how the mineralization appears. So this is part of the pattern recognition skills that you're going to need as you look at mineralized dentin. So some of this is mineralized and some of it is not. And these higher mag views are very good to look at very carefully. You can kind of see the tubular nature of dentin here and the partial mineralization of the dentin. And here again, in the back of your mind, you're thinking of, well, what do biofilms look like? So there's no biofilm in this. These were all virgin teeth. There were no restorations in the teeth. So the chances are none of this is a bacterial biofilms. This is simply mineralizing and demineralized dentin. So I hope this helps a little bit, starting you on your path to recognizing what normal dentin looks like or can look like. Here's another shot of the other half of the root. And here you get a completely different view of it. You can see the fibrillar nature of the collagen here that is not completely calcified, hasn't been mineralized completely. Some of this may even be some predentin fibers. There you can see the cross-linking of the collagen and the partial mineralization of the collagen. So I hope this helps in starting you on your path to looking at these with a little bit of discrimination.